So as I said before, this is only going to be for the members of our club and only when they need to review something, if they can't remember what was said. So it's not being put anywhere out there for the public, is for our own record. So I will share my screen so that we can review the documents that are necessary. So I think I should open the document first. That would help. All right. So on my desktop, I have the resolutions. Here we go. All right. And thank you, Charmaine, for having taught me something this week that I thought I knew, but I didn't. You actually taught me that I can do something different when I'm sharing my screen so that it makes it a lot easier to switch between different documents. So there we go. So this is the document called the Provincial Annual General Meeting Proposed Resolutions, Commendation, and Bylaw Amendment Package. And so this is our logo from BPW Ontario. And then this is the official name, Business and Professional Women Ontario, member of the Canadian and International Federation of Business and Professional Women, known as BPW Ontario. And the AGM stands for Annual General Meeting. So during this is the table of contents, and I did send that in the email, so I won't read all of that. Then we are looking at resources. The part that we need to do this evening is coming up, Resolution 2024-01. Normally we don't read all of the background, which is why I had sent it earlier. I don't believe you got that, Kendra. You got it at 5:30 this afternoon. Was that enough time for you to open it and quickly look at the background of each resolution? We can't hear you there.
Yeah.
It was?
Sorry?
Okay. Was it enough time when you received it at 5:30 for you to have opened this document?
I skimmed a bit. I just got back from Toronto.
Oh,
At
my goodness.
5:30-ish. So yeah.
Okay, traffic. All right, so normally we don't read the background, but what we do read is the part that we need to vote on, and that begins here with what we call the whereas.
Jocelyn, I just explained to Kendra that the background has a lot of information in it. And if you have any questions about any of the whereas, we can go back into the background and find answers for you, okay?
Thank you.
Thank you so much.
You're welcome.
All right. Whereas pending, or actually I should read the title, Resolutions 2024-01, expansion of funding to increase options for women who are victims of violence to live safely in their community. And this is submitted by BPW Brampton. Whereas pending or actual separation was present in 67% of homicides investigated by the Domestic Violence Death Review Committee between 2003 and 2018. And whereas IPV costs the economy $7.4 billion annually, and whereas between 2011 and 2021, police reported 1,847 women and girls who died by homicide, and of the cleared, solved homicides, almost 9 in 10, which is 88%, involved a male accused. And whereas the 2019 Moreau report indicated that more than 60% of those who utilize emergency shelters in Canada are women, and 80% of women seeking shelter as a result of abuse cite a former or current intimate partner as being their abuser. And whereas the 2019 Moreau report provides a snapshot into a day in Ontario, 42% of shelters were at capacity, and shelter being at capacity was the reason women were turned away in 82% of situations. And whereas in 2000, sorry?
82%?
82%.
That is awful.
And whereas in 2009, 15% of female victims of spousal violence obtained a protection order, that is, a restraining order, no contact, or a peace bond, and 32% of these orders were breached, 65% of which were reported to police. And whereas the most dangerous time for a victim of intimate partner violence is during a pending or actual separation, which was a risk factor present in 67% of homicides investigated by the Domestic Violence Death Review Committee between 2003 and 2017. And whereas the most dangerous time for a victim of intimate partner violence is during a pending or actual separation. Did I read that one already? I think I did. All right. And whereas Project Guardian is a pilot emergency response system program in the region of Peel, which uses a mobile GPS tracking device to improve the safety of those at risk of violence from assaults, human trafficking, hate crimes, and domestic violence. Therefore, be it resolved that the Business and Professional Women of Ontario, BPW Ontario, strongly urges the Government of Ontario, specifically the Attorney General, the Minister of Children, Community and Social Services, and the Associate Minister responsible for children and women's issues to establish core funding to expand to programs similar to Project Guardian, a pilot program in the region of Peel, across the province to improve women's safety and reduce the impact of gender-based violence. So the therefore is the ask. This is what we want the government to change. The contact is Mina Di Domenico from BPW Brampton. She's the Resolutions and Bylaws Chair. And Rihanna Ramazar, again from Brampton, the Young BPW and Resolutions Committee Chair. There are references here, and then we would go on to the next one. So at this point, do we have our open document in front of us to refer to, or do I need to leave this one up while we talk about it? Do we all have our document in front of us? Yes, so I can just stop sharing for a moment. So I have another document here open where I need to enter our feelings and any recommendations that we have. So that's the document I'm going to share at this point. Let me see if I can share this. And it is called the BPW Ontario Resolutions and Commendations Proposed Bylaw Amendment Feedback Form. Now that's quite a mouthful, but that's what this is. And it needs to be sent back to the clubs by April 30th. So these are instructions on how to proceed with this. So I've already filled in our club name, and I'm the one who's going to be the contact for this. So we just reviewed the first resolution, and it's called the expansion of funding to increase options for women who are victims of violence to live safely in their community. My first question is, do we need to suggest any kind of amendments to this?
Is any comment? No, any comments or anything from anybody?
Anything at all?
Any questions?
Any
What did you get from
changes?
that? I was curious how the GPS system worked because I didn't read about it. It wasn't clear in the backgrounder.
Okay. Would you like me to put this here as a, not necessarily an amendment, but a question?
Yeah, they might, be helpful to understand. Like, I don't know, did anybody else get that? When they read the backgrounder?
The use of the,
Like, they talked a lot about the GPS, but I thought, well, how does it work? Does it go on the guy? Or, yeah, I know it goes on the woman, and it's a way for her to contact the authorities, but
Mhm.
like, how does it keep her safe? I don't understand really. She
By
can
letting the
contact them quicker,
authorities,
but
I thought it was by letting the authorities find her easily.
well, yeah,
So if she goes missing and she has her phone with her, the GPS is available automatically on the phone, and it's something that authorities can access easily. But we can ask the question and then they can
yeah, I
answer the
think that's a
question.
good question. If they can give us some clarification
Okay, so
on how.
please
you know,
clarify how the GPS can help
Oh, they're
women.
tracked. Actually, she's being tracked all the time.
Mhm.
yeah. Yeah,
And
and
if anything is happening, they'll know instantly. And I'm sure this system is hooked up to something,
That's right, it is.
rather than our regular GPS that, we use when we feel like.
Mhm.
also it says that it allows her to have some normalcy in her life, and she can continue to go to work
Yeah.
and whatever schooling, whatever it is that she's doing, so that she's not hiding in a shelter.
Yeah.
Be very traumatic for her, but also for her children if she's got children with her. And
Absolutely.
and yeah, I would say the GPS not only tracks her location, but also it makes it they must have specialized GPSs so that if she needs help at all she has to do is press a button or something.
Yeah.
You
The
know,
last sentence from the first paragraph pretty well sums it up. It says the GPS tracker has an emergency call feature linking all details of the individual's case directly to the police, and once pressed, allows allows for an immediate response by police should the perpetrator violate the court order.
Okay, so I'm going back to you said the last paragraph or the first paragraph?
The first paragraph, the back
First paragraph.
the last sentence of the first paragraph.
Okay. Has an emergency call feature. Okay.
yeah.
Okay. But the person has to press it for it to work.
So if he gets in and she's coming out of the shower, she doesn't have it
She doesn't.
for any reason, he is aware of it and he grabs it and takes it away.
Hmm.
It doesn't get pushed. Like
Mhm.
there's, so I was just curious how
Yeah.
it worked,
Well, it's a good question.
Maybe it's like one of those things that they put on the people that are under house arrest, and it's locked under their ankle.
That would be for the perpetrator, but what about the victim?
Yeah, but maybe they have a smaller one that, you know, maybe
So
that's how
here,
the tracker is attached to her.
so
Is
here what we're doing is we're assuming and speculating
Yeah. So
because it's not clear.
So that's why we're asking the
I'm just
question.
asking that it be
That-
clarified.
That's a good question. So we're not saying no to this.
Oh, we're
saying
definitely not. I'm
no,
saying yes
yeah,
to it
we're
all the
saying
way.
yes,
Just want clarification
but
on
we
how it
just want
works.
clarification. So do we need any other notes in the feedback?
I don't have a note, but I do, I do have a comment that
Mhm.
even if, it's something that's handheld that you wouldn't take in the shower, that you wouldn't, something is better than nothing,
Absolutely.
Mhm.
and that we can always improve upon it if and when that happens. I mean, as a victim, how much do you want to carry around? I mean, clearly you want to keep yourself safe,
Right.
but it begins to be like, really, I have to do all of this and he gets to do nothing.
Mm.
Like that's,
Well, the point is though, I understand your concern. But yeah, you do have to do it because if you don't, uh,
no, yeah, if you don't,
you
the
know,
chances are
your
the
end result is
unfortunately
not.
this, yeah, the statistics are nasty.
Mhm.
Yeah.
But yeah, just like what I'm saying is that before we get picky on what, why, how it won't work, let's
Let's
at
find out
least and find out how it works.
how it does
Mhm.
work. Yeah.
I
Okay.
have a friend who wears a watch and it never comes off of her. It's waterproof. So when she's in the shower, she's disabled. So if she happens to fall,
Yeah,
Well,
it
see,
automatically
see,
falls.
it's like one of those Apple phones or the other one. I can't remember.
Apple Watch, yeah.
Yeah, the watch. That's, if it said something like that, what it was. I just was curious how it worked.
Mhm. It's a good question.
Mm,
Oh,
Okay.
no, I'm glad you asked that because we should be clear about it. But
Absolutely.
obviously they're using it and it's creating some good things.
Mhm.
But it would be nice to know exactly how it worked.
The
Okay.
statistics in this background are appalling. They're
Yes,
just appalling.
absolutely. Yeah. Is there anything else to add in the feedback? So this one is, we can call it done.
Are you calling for a vote on it or?
Well, we already said yes. We already said that we all
Okay.
support this, right? Does
I think
anybody object to?
I think a positive thing about that particular thing you're talking about might be that maybe the shelters won't be quite as filled.
Could be.
I have no idea, but I'm
Yeah.
reading this whereas here.
Yeah,
The
'cause
overall
they-
report provides a snapshot into a day in Ontario. 42% of the shelters were at capacity, and shelter being in capacity was the reason women were turned away in 82% of situations. Whereas if they have this thing they're wearing or carrying, at the the request goes immediately to the police.
Yes.
So maybe
true.
it'll help with the shelters too.
And the sad thing is that it says that the worst time is when someone is leaving
Yeah,
and they may not have access to this already. Like, what do you do? Like, that's the worst time and they haven't even been to the police yet.
Yeah.
Quite possibly.
I don't know if there's a solution to that. But
Yeah.
Mm.
That's obvious anyway.
Okay.
But we can.
So maybe something needs to be added into the Apple Watch or Apple Watch, it's
Yeah.
not an Apple Watch, but maybe there just needs to be something in all women's watches.
Yes.
Since we're wearing them to sleep and do everything anyway.
Yeah.
Maybe that's the next thing. I don't know. Just a
Yeah,
thought.
I like that suggestion. I don't know if anybody else wants to, but yeah, if that was, I don't,
How
But
about
I
we
don't know.
suggest that all women in that situation should be provided a watch that has that GPS capability?
well, that's the question. We don't know what the GPSs they're doing. It may be a watch already. It may be one of those things they hang around their neck, right?
Yeah, it could be.
But we don't know what it is. And it does beg the question of, since the worst time is when someone's leaving a relationship, how can they be protected? I just want to back up what Anne said about if the shelters are not as full because women are able to feel safe to move around, that may make it better for people who are in that position. But
Yeah.
Sometimes the problem comes right down to the basics, though. A lot of women will not tell you they're having problems,
that's right.
and
That's right.
so
Nobody
you're
knows.
trying to escape, but you're trying to do it on your own. And I don't know, it's pretty scary.
It is. So should we add anything else to this, or do we have enough here?
I just have a question.
Yes, sure.
Sure.
It's regarding the same thing, but I think I'm just looking at it out of tech perspective because this is a good perspective to it.
Hmm.
But like you all of you do wear watches the whole time, like even to the bathroom and sleep if it's waterproof or no?
If a person
I
was feeling that they needed to be protected and they would be using that system that's being proposed, then these people would definitely make sure that they wear whatever that device is that they have been provided with.
Mhm.
A regular a person like myself, where I feel 100% safe in my family situation, I don't even wear a regular watch. I do carry my cell phone with me 100% of the time, but that doesn't mean I have it in my hand. But then, my situation is not dire. So,
The good thing, Kendra, is that a lot of women do wear those tracker watches though all the time and
Yeah.
sleep with them because they're counting their steps and their calories and their
Yeah,
sleep
that's
and
a good
everything
point.
else. So it would be inconspicuous probably. And I think that that's a really, thank you for bringing that up. It's really important that whatever they give these women, that it's inconspicuous.
So could I put this in there as a comment?
Yes, please.
So how would we word that? I would
It's
need
gone.
wording. I really like it, but
Yeah, a question that I think we could look at right now too is, like you're saying, these people are gonna wear these watches all the time, or these things that they're giving them.
yeah, these devices.
Where do they get these from? Do they have to be abused before they get it? Do they?
Most likely.
Go, where do they get them? Are they expensive?
I don't know.
Well, no, but that's worth knowing.
There was
I don't
nothing in
either.
the background about that particular aspect of it. Like who would provide them with that?
Yeah, and it might say here, and I've missed it. I don't know.
I don't think so. I don't think
Well,
it
it's
said
an
anything.
expansion of funding to increase the options. So I would think that they mean that I mean, if a woman's leaving an abusive situation, she's not necessarily going to have any money to pay for any extra protection. So that's what this funding you're talking about.
Okay,
Should-
there is a sentence here. GPS trackers are provided to individual victims of violence who wish to remain living safely in their own residence after the perpetrator has left or been removed. The GPS tracker has an emergency call feature linking all details of the individual case directly to the police, and once pressed, allows for an immediate response
Okay, so
should
they
the
are.
perpetrator violate. So it sounds like they're given these.
Yeah.
Yeah.
Okay. So do we need to write anything here in
But
this feedback?
I don't know that we need to just
Okay.
mention how it works. It's really good.
Okay.
But I know that
It sounds as though it's only available to those who have already
been abused.
Exactly. That was what I was going to say next too.
uh,
Can
you
you
know,
get one if you think you're having a problem? Before it gets so bad.
You know,
Yeah.
it's pretty scary. My sister was with a beater and for a couple of years, and the stories that came out after the fact
Yes.
were not good. But she had moved in with me for a week while my husband was away, and she came and stayed with me. She was pregnant and I had a new baby. And when the husband came home, he said, she can't stay here because he knew her husband was dangerous. And so she went to my parents, and the husband went out that night to untangle the dog and went to come into the house, and there was a gun pointed at his face.
Oh,
Ay, ay, ay.
It would not have been good had I gone out there because it was, So we don't say anything because you get punished for saying it, and you do say it. It's the after the fact, but whatever we can do to make women feel safer after the fact. Like, I was separated for 15 months when my husband hung a beating on me, and he'd only raised a hand to me twice in the 10 years before that.
Hmm.
But, so
Yeah, there's no predicting the situation. That's
no. You know, he brought the kids back, and I said something he didn't like, so you hung a beating on me. I'm thinking, where is this coming from? Right? Because he didn't beat me when we were married. So,
Mhm.
so I called the police, and, well, the police came, and because the neighbors called, and I charged him. I would not,
Okay.
but and you don't know when it's going to happen, and when it does happen, if you live in fear, as many people do, it's going to take a really hard time to get out
Yes.
Yeah.
and report it,
Yes.
because that's the scariest part.
Yes.
But with something like this, in my opinion, that is being promoted, that there is safety somehow for women, may discourage the perpetrators, the partners.
I wouldn't want to count on that.
Well, there's no counting on anything. Like, after John had the gun in Gino's face, he wouldn't let me out of the house after dark until I said, let me out. Because I'm not going to be a prisoner in my own home because of him.
Mhm.
If he shoots me, he shoots me. I'm not going to be a prisoner in my own home anymore.
Yeah.
Yeah.
So
Now, one of my
Yeah.
questions is answered here in this one paragraph. It says the use of the GPS tracker alleviates the need for reliance on shelters and provides some sense of normalcy as victims can stay safely in their homes, maintain their jobs, and remain in their home schools.
Which paragraph?
Oh wait, I'm just a minute. Right where we start the whereases, just before that. Page 6.
So right in here. Yeah, that's page 6.
the last paragraph.
Fourth line in the last paragraph.
Okay, so the use of the tracker alleviates. Oh, there we go. Okay, yes, some sense of
So this is
normalcy.
very positive.
Okay. Yeah. Okay. So, do we need to add anything here then?
No.
Okay. Are we ready to go to the second resolution?
Yep.
Okay. So I will go back to the document again. And this is number 1. And now we're into number 2. Resolution 2024-02, funding programs on preventing and dealing with gender-based violence for the immigrant community, submitted by BPW Brampton. And we have the background here, and I will slide down to the whereas. Whereas Ontario welcomed 227,424 immigrants in 2022, with 52% of them being women. And whereas immigrant women often fear stigma because of family abuse or retribution from other family members. And whereas immigrant women may fear deportation if they report family abuse. And whereas there is often no domestic abuse support program available in a person's first language or within a particular cultural tradition, therefore be it resolved that the Business and Professional Women of Ontario, BPW Ontario, urges the Government of Ontario and relevant ministries to provide additional funds available to social agencies working with immigrant communities to provide education for the prevention and handling of domestic abuse, Further, be it resolved that the Business and Professional Women of Ontario, BPW Ontario, urges the Government of Ontario, specifically the Ministry of Education, which controls the curriculum, to include content that addresses cultural abuse in immigrant communities and ensure school boards include the subject of gender-based violence in appropriate curricula for students and in the professional development of staff. And let's see if I can do this correctly. Did I do it? Yes.
What do you need?
Yes, and further, be it resolved that the Business and Professional Women of Ontario, BPW Ontario, urges the Government of Ontario and relevant ministries to develop outreach, prevention, and support programs for working with all members of immigrant families, particularly working with men and boys to develop educational training and information sessions for relevant sectors to increase access to their services for immigrant families. So that's a lot shorter than the other one, but that's what we are looking at right now.
Hmm.
So,
I don't feel
yes.
comfortable with that further, be it resolved.
Which one?
The one that says, and further be it resolved.
Yeah,
Um,
because of men and boys.
well, no, it had members particular, like, I think they're right. They have to work with the men and boys because that's the ones who, in some cultures,
Okay.
who feel they're in charge, and their sisters, their mother, everybody is beneath them. And but I don't think it's just men and boys. I think they have to do the whole kit and caboodle, because if you're a woman in that society, you don't know that that's not right. You know.
Yeah,
It does say with all members of the family.
I know, but then they pick out men and boys.
Yeah.
I think, I don't know, I think just for, I've not had too much experience with this, but I've had some. And it's the women are terrified. They don't know how to deal with this. Now, they need to be educated as much as the men and boys to know that it shouldn't be happening here.
Yeah.
But maybe I'm just being too picky. I don't know.
Would you like it better if that part about particularly working with men and boys would be removed?
No, I think that needs to be
It
there.
needs to be
because
there?
They're the ones that are creating most of the problems.
Okay.
But the all members of immigrant families, maybe that's too loosey-goosey. Maybe it needs to say so that all members of the families understand that men don't have, I don't know what the word is.
So you'd like to see some change in
Just
this
slightly.
sentence here.
Maybe somebody else could help me with that.
it doesn't say specifically about educating the women on
No.
their rights to safety.
Yeah.
That's what I think I'm hearing from you, and that's what I'm looking at. I think that they want to give it programs for working with all members of immigrant families, particularly working with men and boys. And I believe that that is a key important part in it, because in a lot of other countries, well, this could be just speculation on my part, but a lot of places, men are raised to dominate over women. And when
Yes.
they move here, they want to keep up their culture.
Yes, but my point, I agree totally with what you're saying, but my point is the women need to be specifically educated to say, in Canada, this is not acceptable.
Right. So
it's not strong enough.
I agree. Are you saying, Anne, that there should be a further be it resolved that women are educated, that they have these rights?
Yeah, I think so.
You want the verbiage to say that women are educated?
Yeah,
that they have the rights of protection from society against abuse from gender-based violence. Gender-based violence is the men, as a rule, as it says in the background, are responsible for it.
Yeah, the last sentence kind of like develop educational training and
Yeah.
information sessions for relevant sectors
Yeah.
to increase access to their services. Like, that's kind of an airy-fairy sentence, I think.
Okay, that's not clear, right?
No.
another thing is the older generation with their culture. I mean, I have heard specifically about East Indian ladies being abused by the older generation, the mother-in-laws setting her on fire,
Yeah.
kind of thing. So the older generation also has to learn that it's unacceptable,
Yeah.
that it's inhumane, because a lot of that, well, look at how fathers will actually have their daughters murdered because she's with somebody from a different class or
Mm.
something like that. So it's also the older people that have to be educated, and I'm talking men and women.
Kendra, could I ask you a question?
Yeah, she's muted.
Oh,
There you are.
Did you?
Kendra, can you hear me?
Yes, I
Mhm.
can.
Okay. From your perspective, like,
Mhm.
you know, you're in grade 12, you must see other, you know, immigrants and whatever. Do you ever hear, like, what would you say to this particular thing? And from your perspective, it would be very interesting to me.
I think, well, I am an immigrant, but I am very grateful that I don't come from such culture that really pushes women down. Or,
Yes.
or even if I do, my family doesn't hold those values.
It's fairly
Um,
obvious, my dear, because you're so smart and you've done so many things.
Thank you. But I think for at least those around me, like in school, because I know I have a lot of friends who are not only immigrants, but so they're either born here but have another culture, or they're immigrants. Um well, I nobody has actually told me about um like any like violence, like, or of physical abuse in the family, but they have, I can tell that some of them are, for example, compared to their the parents comparing the daughter with the sons, they give more freedom to the son than the daughter. But that's also, I guess I understand, because they also want to protect them, like the daughter, because of how the world treats women currently.
Yeah.
So there, it's quite unclear because I don't know the family dynamics.
Yeah.
So far, that's my observation. It's mostly to protect them, but like that's why they give so many rules and so many things like that. But there's no violence, as much as I heard, at least. And I don't think like um I don't think like I think someone said like women don't really want to talk about it outside of it, like, or they don't realize that they're being abused. So
Yeah.
that's another thing as well. But I don't know if that answered your question, because I myself don't have much experience in this.
Yeah, no, I didn't assume you did. As I said, you're far too, you're out there, my dear. And I
Thank
have great
you.
faith in what you're doing.
Thank
But
you.
I just wondered if you'd heard, you know, you're at an age where you might have seen something or heard from some people. But the protection thing is a kind of sometimes a shield or something to do whatever you want. Oh, I can't let you go out with that boy because he's not with our culture and he would probably be bad. Well, that's just not true, you know.
Yeah, that's
So,
another thing.
Anyway, thank you. I appreciate you answering that the way you did
problem.
this. It's always good to hear from some young people because obviously we're
Oh,
not.
it is. It is. We need to hear that. Thank you for asking. And thank you for sharing, Kendra.
No
That's
problem.
that's
Don't feel free to
awesome.
ask more questions.
So,
So-
Anne, can I clarify what you're trying to say here?
If you could clarify, that'd be good.
Okay, and what we're saying is that we agree with the resolutions, but in the end, if further be it resolved, there is a focus on men and boys, but someplace up in the other resolves, it should say something about teaching women about their rights in Canada.
Yes, and that's probably the best
And
way.
that's what appears to be missing from here. So
Yeah.
Jocelyn, can you write that down?
Could that be added to this one here, since they're already talking about prevention and support programs and
But
educational training?
But we wanted to specifically mention women and girls.
Yes.
Okay,
To specific, so you've got here Ontario welcome 52% of women. Immigrant women often fear stigma because of family abuse and retribution by other members. Immigrant women may fear deportation if they report family abuse. And there is often no domestic abuse support program available in a person's first language or within a particular cultural tradition. Therefore, be it resolved that we urge the government of Ontario and relevant ministries to provide additional funds available to social agencies to provide education to women for the prevention and handling of domestic abuse.
So instead
then
of
we
just,
can-
yeah, right there,
And
correct?
then you have the further be it resolved that going down. And when you get to the third one, where it says, particularly working with men and boys, that fits then. But there's no place in here where it says specifically, the women need to be taught that they have rights.
Yeah, absolutely. Because trying to teach the boys is not going to make much difference because nobody's going to give up power.
What will make a difference is if the women are educated and they have a place to go and they have resource, then it will make a difference because
Yeah,
the boys
if they
and
know,
the men. Mhm.
but they have to know.
Yes,
So right up in here, you want some wording added after education.
so to provide education in the first, therefore be it resolved that provide additional funds available to social agencies working with women, with immigrant communities to provide education to women.
Yeah,
To immigrant women for the
Yeah.
prevention and handling of domestic abuse.
okay, so then I'm going to copy this and go to our other document here. And this
Can
is
we
it.
also add, can we also add in their first language when possible?
Yes,
So to provide education to,
immigrant women
in their first language.
in their first language if possible.
Okay, I forgot the
For
S
the
over there.
prevention and handling of domestic abuse.
Okay, so these other words are there already, correct?
Yes, yes.
Okay, so
So you're
this
just
is-
kind of squeezing that in there, right?
Mhm. Yeah, to provide it.
Possible. You've got to spell better.
Oh, sorry. There. Yeah. So
Okay.
the words that, which words are already, the words that are already there is to provide education. So I think I can remove to provide, just giving them the word education, that gives them where to start.
Yeah, I would leave I would
You
leave
would?
that in there.
Okay,
Provide education, just to make sure that they get it.
okay, so for some reason,
If you're gonna highlight anything,
I didn't want
highlight,
to. I don't know
okay,
why it did it, but okay, so if I,
and highlight to
Okay, this is-
immigrant women in their first language.
yeah, to provide education, and then I'm just gonna remove that part. To provide education, so that's an E, to immigrant women in their first language if possible.
Yeah.
Okay. All right. Anything
Can you
else for this?
highlight that part to immigrant women in their first language,
Mm, Right
if
click.
possible?
How do I do the style?
Control B,
And I'm sorry, you said that again?
Control B,
Control B. Let's try that. Control B. Hey, thank you.
and do if possible as
Oh,
well.
okay, so do that as well. So Control B.
Yeah.
Okay.
Okay.
Anything else for this one?
I think that, Anne, are you comfortable then with the part with
That's
leaving
much,
the
much
boys?
better, yes.
Yeah,
But I'm
okay.
looking at this, one of the whereases. Immigrant women may fear deportation if they report family abuse.
Exactly.
Well, that's why they need to be educated.
Yeah.
Exactly. They
Yeah.
need to
Not
be
just the men
educated
and boys.
first.
You don't just tell them they can't be powerful anymore.
Yeah,
You
Yeah.
have to tell the women they can't, that the men and boys can't be powerful.
yeah.
Mhm. Okay. Yeah, that makes sense. Okay. So do we need any additional wording in here, or is this clear enough? I think it is.
I think it is.
I think
Okay.
it sounds pretty good. Thanks, Charmaine.
Okay. All right. Anything else for this particular one? If we're not, we're going to move on to the third one.
We're gonna fill in yes?
I'm sorry?
We're gonna fill in yes?
Oh, you're right. I didn't do that part, did I? Right here. So thank you. I should capitalize that. So it's, there we go. Thank you. I forgot about that. All right. So go back to the document and we are looking at the third, which is Resolution 2024-03, funding bail court notifications to victim services agencies, and it is submitted by BPW Brampton. So I'm going to go down to the actual whereas. Whereas the majority of victims of violence are women and girls, and whereas innocent lives are placed at increased risk due to a lack of timely and accurate bail court notifications to local victim services agencies, and whereas there is no consistent province-wide court process that prioritizes the safety and security of the victims with bail court notifications to victim services agencies in parallel with bail outcomes. And whereas the provincial and territorial governments are responsible for the administration, management of justice, including bail conditions, which does not include a consistent province-wide bail notification process to victim services agencies. And whereas Section 7B of the Canadian Victims' Bill of Rights, SC 2015 C13S2, states that victims have the right to information regarding the location, time, progress, and outcome of the proceedings related to the offense. Let me see if I can do it. And then did I go too far? No. There we go. And whereas Section 212.vi of the Victims' Right of Bill of Rights 1995, SO 1995 C6 S41 states that victims have the right to information regarding their role in the prosecution. And whereas without timely and accurate bail court notifications to local victim services organizations, significant strain will be placed on the justice system, police services, Crown offices, hospitals, and victim services agencies. Therefore, be it resolved that the Business and Professional Women of Ontario, BPW Ontario, urges the Government of Ontario and relevant ministries to A, implement and fund a consistent bail court notification model throughout Ontario, leveraging court staff and police services staff to ensure accurate and timely bail court notifications are provided to all local victim services agencies. Ensure sustainable funding for the bail court notification programs to all victim services agencies where Victim Witness and Assistance Program, VWAP programs, are unavailable to protect the lives of victims. So my first question is, do we agree that this is necessary? Is this a yes?
I think so. I would not want to have pressed charges and then find out that the offender has been out on bail and
Yeah.
could be creeping in your backyard to come and
Mhm.
see you.
Okay.
So yes, I do feel very strongly that the victims should have full access to whether this person has been released. Where are they?
Mhm. Okay.
Surely you would think the police would keep an eye on where this person is.
Okay.
And
So
then-
Yeah,
in-
I think
so-
one of the things we're gonna have to find as a problem in this situation, there aren't enough police to do the job properly,
yeah.
yeah.
you know, like, but we have to ask for it. I mean,
Mhm. Okay, so it is a yes. Okay, what am I doing here? That shouldn't be there. That should be, I'm in the wrong document. There,
I
that's,
think that that is absolutely important because people are not going to report if they think that someone's going to get out on bail and
That's
take them
right.
out. You got to know that
Well,
they're being out, that they're coming out on bail. Got to know it.
I've forgotten the details already, but in the last few days, I read about an article in the paper where somebody was released on bail and people can't believe it. So it happens.
I
Well,
hope
there
the
was somebody
victims.
who killed 3 women last week,
Mhm.
this
Yeah.
week, last week.
Yeah.
No, because he's let out of prison or out on bail and nobody knows that he is. If
That's
the
right.
victims don't know, they can't protect themselves.
Exactly.
So do we need to suggest any change of wording in here? Or are we satisfied with the way this is?
Well, I don't think we can do much better.
Okay. All right. So we don't have any comments, and that's okay. Right, so I'm gonna slide up a little bit. And we can go on to the fourth one. And that would be here. So that's 03. And here's the fourth one. Resolution 2024-04, declaring intimate partner violence an epidemic. It is submitted by BPW London. So there's quite a bit of background here. And go to the whereas. Whereas intimate partner violence, IPV, affects women, children, and gender diverse people in Ontario. And whereas the verdict of the coroner's jury into the deaths of Carol Culleton, Anastasia Kuzik, and Natalie Warmerdam, issued on June 28, 2022, stated as its first recommendation that the province of Ontario formally declare IPV an epidemic. And whereas the province of Ontario is to be commended for the funding it has provided during 2023 to organizations and agencies that assist victims of both IPV and gender-based violence. And whereas to date, the province of Ontario has not fulfilled the first recommendation outlined above. Therefore, be it resolved that the Business and Professional Women of Ontario, BPW Ontario, urges the Government of Ontario, specifically the Ministry of the Attorney General, Ministry of Children, Community and Social Services, Ministry of Citizenship and Multiculturalism, Ministry of Intergovernmental Affairs, Ministry of Labor, Immigration, Training and Skills Development, Ministry of Legislative Affairs, Ministry of Municipal Affairs and Housing, Ministry of Northern Development, Ministry of Public and Business Service Delivery, Ministry of Seniors and Accessibility, and Ministry of the Solicitor General to immediately declare intimate partner violence an epidemic.
Yeah.
I'm stunned that this was suggested on June 28, 2022, and that it hasn't been implemented.
it seems to be missing something.
Okay,
I understand that that they want it to be declared an epidemic, because I think it is.
Mhm.
At least in a lot of segments of society, not in all of them, but even in the higher up ones, again, women don't report.
Mhm.
But once it's been declared that intimate partner violence is an epidemic, what's next? What does that do? How does that help? Like, I just feel like I'm left hanging. That's where I'm coming from.
So there's something missing.
It
Well,
seems to
what's
be.
missing is right up at the top, where we commend the province for giving money, but then we turn around and say, yeah, but they've done nothing about it.
Yeah. It's given money to these, to assist the victims, but once you declare it, then okay, we've declared it an epidemic, so what? So if it's an epidemic, what are the consequences? What are the powers that the government gets, or that all of these educational ministries get, to help ease it? You
Yeah.
know, with COVID, you had the masks and the staying safe and social distancing and things like that. But this is, okay, so it's an epidemic.
Yeah.
Well, now what?
Now what? Yeah, that's basically it. It's an epidemic. Now what? You know, once you declare it, then there has to be further steps, does there not?
Yeah.
I think the one we just finished doing kind of relates to that, doesn't it?
Mhm.
Yeah.
Like the previous resolution, number
Mhm.
3,
Mhm.
relates.
That's letting us know that because it is an epidemic, that notifications to victims, what is that? It was number 3, was funding bail court notifications to victim services agencies. That's a step that this extra funding can do, but what will that funding or this declaration do for the victims of intimate partner violence?
And maybe it'll help.
there
Maybe
could be
it'll help them.
something, something could exist out there already that states that once something is declared an epidemic at government level, some services and money kick in that otherwise wouldn't.
Highly unlikely, but
It's a good comment, but
yeah.
not anywhere in here. So
Mhm.
I
where-
declare that there's an epidemic. Okay, so what are we going to do about it?
Yeah, so
Yeah.
if you've declared an epidemic, so what?
Yeah. So
Now what?
so
What does
so
that mean?
basically,
What does that look like going forward?
Yeah.
So what we're doing here is we're saying yes to this, first of
Yes.
all,
Yeah,
so
we
that I
agree
don't
that,
forget. And then in the comments, we say declare intimate partner violence an epidemic, and then so that something will happen. And what will this something be?
yeah,
So,
ask the question, yeah.
so that, and then what will happen? Okay, just like that.
What will be the
What will be the outcome?
outcome
Yeah.
of declaring this an epidemic?
Consequence, yeah.
What will be the
Consequence, the outcome, the ramifications of it
do
for
you
the
want all these words there?
perpetrator. Pardon?
You want all these words there? What will be the
I'm
consequence?
just throwing stuff out.
I know, but I could write it.
No, we don't need all the words.
So,
Is outcome enough?
but what are the ramifications of this happening? That, you just said that basically.
What
Yeah,
will be the
because-
outcome?
Yeah,
The ramifications.
ramifications.
I can't even write. R-A.
Sorry, I'm looking at mine.
I know, me too. I can't spell tonight.
Ramification.
Ramifications.
That's it.
There. What will the ramifications be?
Yeah.
What will be the outcome? Okay, what will the outcome and the I gotta have an and in there.
No,
And
what will the,
what will the outcome and the ramifications be?
Yeah. But I like your so what in there, right? Because that's where I'm feeling when I read the end of it. It's a necessary thing, but what's it gonna do?
Yeah, so
yeah,
that,
like, I think
Question
that
mark.
they have to go back to the whereases. Because whereas intimate partner violence affects women, children, etc. Whereas the verdict of the coroner's jury on June 28, 22 stated as its first recommendation that the province of Ontario formally declare IPV an epidemic. So then the province of Ontario gives some funding. I don't know who to who or where or whatever.
to
And so
organizations
what
and
they've done with it.
agencies.
And
Yeah.
then they have, but they still haven't called it an epidemic.
Yeah.
So like they've got to go back to their whereases and kind of connect it to the end, I think.
So where would you put more wording in this part?
Oh God, I don't know if we've got time tonight to do that.
No.
Probably not. Okay, so
I look at the resolution, the first resolution where we had 3 therefore it, and also therefore be it resolved, right? That there should be
Yeah.
something resolved here. Some of the things, whereas it's a given that intimate partner violence affects women, children, and gender diverse people. That's a given.
Yeah.
And whereas the verdict of the jury stated in its first recommendation that the province of Ontario formally declare intimate partner violence an epidemic.
Yeah, they have said that, Larry.
Yeah.
Yeah.
And whereas it's funded, and whereas it didn't fulfill the first recommendation, like
No,
it
it
gave the
didn't.
funding, but it didn't fulfill the recommendation.
That's right.
And you know, why not? Why hasn't that been fulfilled?
Yeah. Okay. So
Yeah,
did you
like
want,
in the first therefore it be it resolved, it says to immediately declare intimate partner violence an epidemic.
that's right.
That has got to be, that shouldn't be at the end of the sentence. It should be at the beginning. Before all the listings.
No, you have to give all the departments first.
Yeah,
I
they have to
believe
give the
that's-
departments first
Yeah,
because they're addressing them.
yeah.
Yeah, that part's correct.
But they could have, and therefore be it resolved that when this happens, there will be consequences or whatever, deterrence, whatever.
Yeah, I know that.
We can't say that.
That therefore be it resolved has got too big of a list. And it's sort of an afterthought that they threw in the declare.
Mhm.
So
Anyway,
what would you like to be to do in the document that we're sending in here?
well, we put something already, didn't we?
Yeah, we put declare intimate partner violence an epidemic, and then I wrote so that question mark, and then what will the outcome and the ramifications be? That's our question.
Yeah, I
We want them
guess.
to add something after the word epidemic.
Yeah.
Mhm.
So is that sufficient for this one?
I think it'll do for now.
Okay,
I think Norma did this all by herself. So
yeah, she probably
that
did.
was tricky. That would be tricky.
Yeah, okay. So can we move on to the 5th one?
Yeah.
We have 4 to do. We still have time.
Yeah.
And we have 4 to do. Okay, so I'm going to go back to the document and do number 5. Then this is 4. and that's 5. Resolution 2024-05, expanding access to community mental health support and services in Ontario, submitted by BPW London. So we have the background. Okay.
Well, I
Whereas,
sure agree with this one. Holy.
whereas statistics indicate that by 2021, 1 in 5 Canadians experience mental health issues, and in Ontario in 2022, almost 1.2 million women perceived that they suffer poor mental health. And whereas there are no mental health specific language guiding employers' responsibilities to support employees experiencing mental health concerns, and whereas there is no employment leave mechanism for families or individuals to support a mental health crisis, and whereas after almost 4 years since the Ontario government stated it was a serious issue, the barriers to individuals seeking assistance with mental health in many communities indicate that universal and accessible access to mental health care remains a challenge, and few plans have been initiated to correct the problems. Therefore, be it resolved that the Business and Professional Women of Ontario, BPW Ontario, urges the Government of Ontario and relevant ministries to establish permanent, ongoing funding to expand the delivery of high quality, accessible, and free mental health services using the principles of universality and accessibility, and to establish program standards to provide Ontarians with mental health services that are timely, universal, and culturally competent in all areas in order to allow all areas of the province to focus on solving critical backlogs in service and helping individuals in accordance with their unique needs. That further be it resolved that the Business and Professional Women of Ontario, BPW Ontario, urges the Government of Ontario and relevant ministries to undertake a comprehensive review of the criteria for access to the Ontario Works, Ontario Disability Support Program, and other provincial benefits programs to ensure mental health benefits are available to individuals experiencing mental health challenges. B, to include mental health as a specific element of the Ontario Occupational Health and Safety Act and require provincially regulated employers to take preventative steps to address the mental health of employees and their families. And C, to add specific defined leave to the list of other items in the Employment Standards Act, ESA, for individuals suffering from mental health issues, and to any ESA-defined caregiver providing support to that individual. Wow, that is a mouthful.
That is probably the, I was just discussing that with someone this afternoon.
Okay.
And it's probably one of the most serious things in this province. We don't have enough places. There's some for children. We have Pastone here, and there's some for elderly. There's nothing for anybody, say 30 to 40 to 50. Nothing.
Yeah.
Unless you got piles of money and you can put them in an institution for 6 months or something. You know.
Yeah.
It's really bad.
Yeah. Do we need to make any suggestions for changes to this or additions?
I know you can't put this in, but I would like to say, take the money from that highway that you are going to build up in the north and put it towards this program.
I agree. Oh,
And
Lord.
I know you can't put it in there, but
I know.
boy, oh boy, that would make so much common sense. But then we're in short supply of that.
Yes.
Hmm.
Any additions, changes needed?
I like the fact that they put in free mental health services, because if you've already got a mental health problem, you're not likely going to be having any extra money to go, you know, out to do anything with it.
Yeah, that's true. Yeah.
Yeah.
I think it's very necessary. I know back when my daughter was a teenager and I tried to get her into counseling, we were having some challenges. And there was a 4-month waiting list.
Yeah, at least.
That was 40 years ago, you
Yeah,
know,
Yeah.
35 years ago.
I think it's
And-
longer. No.
I was
Yeah.
diagnosed with clinical depression back then. I got
Mhm.
10 weeks off work
Oh,
and
geez.
medication. And the psychiatrist, that's all he would talk was medication. I
Yeah.
had to say, what about cognitive behavioral therapy? What about what else can I do? Because drugs alone are not doing it.
Yeah,
That's right.
You know, I got myself put into a 10-week program at the hospital, but the psychiatrists, they didn't care. And if
Yeah.
that's still carrying on,
it's not that they don't care, they didn't care at the time. There was nothing they could do.
all they could do was give medicine.
Yeah,
But I went to 2 different psychiatrists, and not once did anybody say, how are you doing?
no,
What are you doing to help yourself?
Yeah.
You know, or even offer suggestions. It's just, here, let's try a different pill. That one's not working.
yeah.
So we're
Unfortunately,
definitely
that's still happening.
a yes on this one.
Yes. It's
And
yes, as is.
as is. So no changes. I just don't put anything.
I think that's okay, yeah.
All right. So we can move on to number 6, which is
I think
well,
people need,
figure-
there's
Okay.
more they need than just drugs.
right here. Resolution 2024-06, moving to a free prescription contraceptive plan in Ontario, submitted by BPW London. Whereas OHIP provides a limited free contraceptive program for persons under 25 years of age or others with disabilities and income challenges, but only if they qualify. And whereas women who do not qualify for available programs by the Ontario government, public health units, other agencies, or private medical plans are required to fund their own contraceptive needs. And whereas the Government of Canada has announced their intent to work with provinces and territories across Canada on national universal pharmacare that will include a wide range of prescription contraceptive choices. Therefore, be it resolved that the Business and Professional Women of Ontario, BPW Ontario, urges the Government of Ontario, specifically the Ministry of Children, Community and Social Services, and the Ministry of Health, to work closely with the Government of Canada with their national universal pharmacare, so free contraceptives will be available to all women of reproductive age in Ontario. So it was submitted by all of BPW London, so I hope she didn't work alone on this one.
Well, yeah,
So first of all, do we agree that this is necessary?
Yeah.
Okay, so I'm gonna write yes on this one.
I don't think that all women need a free contraceptive program.
Hmm,
You know, there are women out there making lots and lots of money.
that's true.
And if they want to protect themselves, they know how to do it.
So would you like to specify a limit, such as all women who are living under the, what is it called, the
I hate-
poverty?
I know, I hate specifying that, but
I think, yeah, I agree with you, Charmaine, basically. But I don't think it's a smart move to say, if you can't afford it, you can have it, but if you can't afford it, you can't. Because
I know.
people are still in a situation where somebody checks the bills
yeah,
and
Yeah.
they could be in a lot of trouble. So I think in this case, we have to go with the better part of valor and just let it be.
Okay,
I
If
just,
you know, I'm not
Yeah.
disagreeing with you, I'm just saying that sometimes we have to just go with the flow.
can I ask Kendra what you think about this, Kendra? About free contraception? Is that difficult for you?
Sorry, what do you mean by difficult?
I don't know. I don't know. So some people your age might be a little shy. And so I was just curious, what's your feelings on it?
Um,
You've probably never even thought of it. You know, like, I mean, it's not something that, you know,
I understand.
I guess the question would be, Kendra, would you like all prescription contraceptives in Ontario to be free to all women?
mm,
and we're putting you on the spot. We
Yeah.
know.
So you don't have to answer,
No,
sweetheart.
you don't have to
You
answer.
It's just, I just was compelled to ask what you thought about it.
yeah. Um, well, okay, are they very expensive? Like how much are contraceptives, honestly, usually? If
It,
I
de-
don't have a clue.
it depends what they are.
Yeah.
it depends.
It really depends what they are. Yes.
Hmm.
There are several different kinds of contraceptives. And I
I
think some of them are free, as a matter of fact. I think if you go to, oh my goodness, if you'll forgive me for a second, I have to.
You can go to the free clinics that the Americans are trying to abolish.
Yeah.
And,
My
you know,
granddaughter is quite ill, and my daughter was calling with news. Okay. Sorry.
one of the problems is overpopulation as it is. So, you know, if people want to make sure that they're not going to get pregnant for whatever reason, be it society's rules or common sense, you know, they're too young to have a baby. They're too young to take that responsibility. They're in university or college, and they're not ready to start a family. And let's face it, humans are humans, and they're going to be in situations where they could get pregnant. And you think a young girl's going to go and ask her mother, can I have contraceptives? No, you don't need those. You're not going to do that. So, you know, there's a lot of situations there that keep the girls from being protected, girls and women, and women.
Okay,
girls.
here's an answer to your question. One of them. Ontario's health insurance plan, OHIP, currently covers contraception for individuals under the age of 25,
Yeah.
as long as they aren't also covered by a private plan.
Yeah.
Recipients of Ontario Works and Ontario Disability Support Programs may also qualify for free contraception. And the NDP is presently working on getting it covered by OHIP for everybody.
Are you reading that in the
In the background.
the background?
I
Okay.
Googled it.
Oh, you Googled it. Well, the thing is, I'm pretty sure they've read that, the people that put this together.
Oh, I'm sure.
Mhm.
Uh, Nancy, I think when you said about like some girls don't want to like tell their parents, like that's definitely something.
Yeah.
But for me, I think every time I go to the family doctor, because we usually have like yearly or like bi-yearly
Yeah.
like appointments. First of all, my mom is there with me, but then she like tells my mom to go outside because she needs like me to answer some questions, and she believes that it would be better if she's not there.
Yeah.
Which then she asked me if like whether or not I have
Sexually
like
active.
You're sexually active.
and if I want to be safe, because then I am more comfortable talking to her without my parents in the room. That's what
Yes.
they usually do.
Yes.
And I think at under the age of maybe 25, like you said, or definitely under 18, they do cover it for free, I
Yeah.
believe.
Yes.
That's why I think in the whereas they also say qualify. I don't know what they meant by that. I don't
Yeah.
know, like by
Just
age, by
only if they qualify.
Okay,
which means that they don't have coverage.
okay.
Basically.
If that's what it means, yeah.
Yeah, I just saw the qualified, which I didn't really know. I didn't really know what it meant. But yeah,
Also,
so sorry, go ahead.
I was gonna say that, if you've got coverage as a young woman, you know, your age, say, just for an example, how old are you, Kendra?
18.
You're 18, okay. So if you're a young person and you're probably covered under your parents' insurance, right?
Mm-hmm. Yes.
So you would have to.
You're not gonna be getting it.
No, because they would find out. If it goes
Exactly.
under their drug plan, the parents find out.
Yeah,
That's my point is
Yeah.
you'd still have to go to them because they're paying for your coverage. If it was free, for you or your
Anyone.
friends or
Yeah.
anyone,
Anyone.
then there is no violation of your privacy.
That's right.
Mm,
So you want to protect that because if the parents, you know, if you go to your parents and say, look, you know, I am an adult, but they're saying, no, you're still my child, and you're gonna,
yeah.
you know what I'm saying?
Yeah.
So you're still kind of under their rules, and that could end up with pregnancy.
It is only found out if the like I'm looking at my daughter's situations, and I have two daughters 5 years apart, and each one of them went through this whole thing that you just described, Kendra, where me as the mother, I was kicked out of the room, and then they talked freely. They never told me what the prescriptions were that they got, and if they went and bought the contraceptives they needed, I never found out because they did not go through our drug plan. They were smart enough to not go through our drug plan, but they also each had jobs that helped them to pay for what they needed. So they were not in need financially because they had good jobs in addition to going to school. So, and I didn't find out and I didn't question, and it was their business and their privacy. But that's not every situation. You know, if someone who is under the parents' drug plan, and if they don't have a job but they still want the contraceptives, then the parents will find out.
If they're going to school, they got to buy their books and everything else. Where are they going to get money for that too?
Well, see, Nancy, it's already covered for 25 and under.
Only
What if she's 49?
No, look, it says and others for persons under 25 of age. Oh, it says or others. Okay, I missed the or.
Or
You're
others
right.
with disabilities and income challenges, but only
Okay.
if they, but what we're talking a lot about young people, but you know, there are women who are on contraceptives up until, well, I could have been on them until I was 57,
Yeah.
right? And if my question is do all women do they have to be universally available? It just doesn't kind of make sense.
If you didn't need them, right? Just because they're free, no, that would be totally
Yeah.
stupid.
But if somebody's making $250,000 a year, should they go and get free contraception?
No. I
That's
don't,
my
well,
question. That's what my question is. Should they be available to everyone at no charge? And which Anne brought up a really good thing, but then you get into the haves and the have-nots, and how do you determine and declare? I think it's fine the way it is right now at 25. Most people, well, not most, a great good number of people over 25 are able to take responsibility for stuff like that.
So what they're asking is that this become a universal pharmacare that provides free contraceptives to all women of reproductive age. And what you're presently saying is that you disagree with this completely. So we're not supporting this resolution.
Well, I'm just saying I don't agree with it, but if it's a vote of the unit, so whatever Niagara Falls thinks, I'm with it,
Yeah.
but it's just a thought that came to my mind. And I don't know exactly what it is it's just universal pharmacare. it just kind of scares me with the drug companies. I don't know. I don't even have a really good reason for it.
Well,
Except
the thing,
I don't
the
see it's
reason they,
necessary.
universal pharmacare, I don't know. I think we have to narrow this down to just the subject they're talking about and not muddy the waters with
Yeah.
universal
Do we
pharmacare.
want to support a program where free contraceptives will be available to all women of reproductive age in Ontario? That's the question. Do
Yeah.
we want to support that?
Consider the number of women that would make huge amounts of money. I think if you look at it for the better of the all, as opposed to getting restricting those who make a lot of money, because how many women are making that kind of money?
Well,
Well,
more than three.
There'll always be some, and there'll always be someone who takes advantage. But the average woman, and what is it, 62 cents to the dollar that they make?
I thought it was 67,
Okay, it might be.
something like that. It's coming, but
I think for the general population, I think it should be.
I think we have to, yeah.
Beth,
So we agree that this is a yes, that this has to be submitted to our BPW Ontario AGM.
do you think comments, Beth?
You would hope that those in those higher brackets would
Do their own.
well, do their own, but I mean, then I don't know. I mean, I just had a conversation with my daughter, and knowing what happened with, like, is this all contraceptives or is this just oral contraceptives or?
All, this is all.
Oh, okay. Okay. Yeah, that's a tricky one.
I guess one of the things I thought of was could relate back to what we talked about culture too. If a woman wants to have contraception and her husband doesn't believe in it, and she spends the money and it goes through his
Plan.
healthcare plan,
That's an
Yeah.
excellent point.
you
Yeah,
know,
And
Then the
that's an
woman-
excellent point.
yeah, absolutely.
I don't think you can really answer this really well. I think you have to just go with it.
Okay, so does anybody object to me putting yes in there for supporting it?
Well-
Moving to a free prescription contraceptive plan in Ontario. That's the title.
I think it's gonna happen federally anyway, so.
Okay.
Now, that'll happen probably before the bail notice comes out.
Yeah. Okay. So no comments? No amendments?
I don't think you can do that with this particular situation.
Okay.
I don't know. I mean, again, like Charmaine says, I'm only one person, so.
Should we have a vote? Like, how do
Well,
you want
if
me as
somebody-
your representative to vote for this at the AGM? Like, do I vote yes
Is-
in your name?
Is somebody against it?
That's the question.
I go with the group
Okay,
Yeah, me
Beth,
and
Nope, I'm good.
we're good. Nancy,
Yes.
Kendra, I realize you're not a member, but do you like this? You do?
Yeah.
Okay. All right, so it's a yes.
so then we'll
So,
say yes.
all right,
Okay.
so we moved on down to number 7 then. Thank you. And we have down to where the therefores are. There. Resolution 2024-07. Implement all coroner's recommendations to combat intimate partner violence, IPV, and declare intimate partner violence, IPV, an epidemic in Ontario, submitted by North Toronto BPW. And when I saw that,
It's the same,
I-
isn't it?
Yeah, and I think I slid down a little too far, and this is the whereas over here. Some of it has already been discussed in the other one by the other club. Whereas IPV is prevalent, how do you pronounce that? Prevalent?
Yes, that's right.
To the extent that on average, a woman is killed by an intimate partner every 6 days in Canada, and with attempted murder included, the figure becomes almost one every other day. And whereas research shows that the number of women and girls killed involving male accused in 2022 represents a 27% increase compared to those numbers in 2019, pre-COVID, and that IPV is an economic burden on women. And whereas the recent Ontario coroner's inquest in Renfrew County on a triple murder made recommendations to declare this an epidemic, among others, that were not accepted by the government of Ontario in order to increase awareness, track occurrences, fund programs, and facilitate multiple ministry actions between social services, judicial, and financial ministries to facilitate prevention and intervention. Therefore, be it resolved that the Business and Professional Women of Ontario, BPW Ontario, urge the Government of Ontario and relevant ministries to adopt all 86 recommendations of the Renfrew County Coroner's Report on a triple murder issued on June 28, 2022, primarily recommendation number 1 to formally declare intimate partner violence an epidemic. Further, be it resolved that the Business and Professional Women of Ontario, BPW Ontario, urge the Government of Ontario to give the Ministry of Children, Community and Social Services, in coordination with the Ministry of Justice and the Ministry of Finance, to give the power to create and fund services for further of these coroner's recommendations, including creation of an implementation committee to ensure the inquest recommendations are comprehensively considered and any responses are fully reported and published, study judges' decisions in IPV cases, and tracking in longitudinal studies for recidivism, violence escalation, and future victims, establish an independent IPV commission dedicated to eradicating intimate partner violence and acting as a voice that speaks on behalf of survivors and victims' families, raising public awareness and ensuring the transparency and accountability of government and other organizations in addressing IPV in all its forms, create a survivor advocate group to advocate on behalf of survivors regarding their experience in the justice system. And now there's a list of relevant ministries. So
Now see, this is the same as the other one, but it's got more juice after it.
a lot more.
My initial inclination is that the two of them should be put together.
Mhm,
Well, and I thought was my first thought.
mhm.
And my second thought was, if we put them both in, maybe it'll get somebody to pay attention.
True.
I don't know.
So they talk about whereas, where does it say epidemic in here though? I don't see the word epidemic
Oh, right up at the beginning.
at the beginning.
Therefore, be it resolved, blah,
Oh.
blah, 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 to formally declare intimate partner violence an epidemic.
There you go. Well, that was the other one. And
the
that's
other
all
one left
that's
you
all the
there.
other one did.
Yeah. Now,
So-
Hattis has gone further in this. She's done a really good job on this.
Oh, yes.
Because she's got what to do once it happens.
Yeah.
Mhm.
So,
Yeah.
Which is what we were concerned about earlier, wasn't it? Like we
Yeah.
said, so what? You know?
So
yeah, exactly.
Okay, so just a minute. I'm trying to select this thing here, so I have to go.
To me, this is a duplication, and if they can be rolled in together, it.
Mhm. All right.
But
so
like
go
Ann
back to-
said, if you put it twice in front of the government, maybe they'll listen.
yeah. So
Maybe they'll dismiss the most powerful one.
to victim services, intimate partner. That's this one here that we're saying they should be combined.
2404, yeah.
2024-04. So here we said, see this whole thing here.
Mm-hmm.
So here we're not going to do a yes, we're going to do a no, because we're going to combine it with the other.
Well, we can't say no.
No,
Okay, we can't
will
say
say
no.
yes here.
We have to
And
say yes.
when, with the other one, with the one we're working on now, we'll just say, this sounds a lot like 2024-04. Can
Sounds
they be combined?
lot like 2024-04. Can they be combined? Whoops.
Like, I think the last one is better because it
Yes.
goes into a little more detail.
It's
Mhm.
stronger.
That's
Yeah,
a 0
much
over
stronger.
here. Okay.
I can make you say, it makes you say, oh, that's
Mhm.
why, they want it, you know?
Yeah,
Yeah. So the first one just wasn't complete enough.
yeah,
And, this one here is definitely very complete.
yes.
Okay,
Yes.
so is this
And you
enough
might put
wording?
that in there. No, this one tells us the so what, right? That
Yeah,
we
maybe
we didn't have an answer to in 2024-04.
In 2024-04. Okay. I don't need a capital T.
I don't think you should say so what.
Well, that's what we put up there, isn't it? No, what did we
Just
put?
put it in,
So
put it
that.
in,
We put so that, not
put
so
it in,
what.
oh, yeah,
So that, sorry. And then dot, dot, dot.
yeah,
Okay. Okay.
good, done.
So it's this. Okay, so it's TH. Okay, all right.
Mhm.
Is this complete enough?
I think, well,
Okay,
that's
I-
me.
I-
And Nancy, comments?
Yeah,
that's good.
Okay. Beth,
right.
comments?
Okay,
Okay.
all right, good. All right, now we're gonna look at this next one here. So that's 7 and slide down to 8, which is this one. So in this one, Resolution 2024-08, support to address the gender pay gap in medicine, submitted by North Toronto BPW. Whereas several cross-sectional studies of this issue describe a complex set of factors associated with payment disparities affecting female physicians and surgeons, considering payment gaps and the variations by specialty, rurality, and practice settings. And whereas even within a fee-for-service system for equal time worked, female surgeons earn less than male surgeons and more commonly perform procedures with the lowest hourly earnings. And whereas on average, women earned 22.5% less than men each workday, or to put it another way, women physicians earned less than 78 cents for each dollar paid to men daily. Therefore, be it resolved that the Business and Professional Women of Ontario, BPW Ontario, urges the Government of Ontario and relevant ministries to undertake a comprehensive analysis of the drivers of gender-based earning disparities, including referral patterns, and highlight the need for systems-level solutions. Further, be it resolved that the Business and Professional Women of Ontario, BPW Ontario, urges the Government of Ontario and relevant ministries to undertake an analysis of root causes of the gender-based disparities within the OHIP-based fee-for-service compensation of physicians in Ontario. And further, be it resolved that the Business and Professional Women of Ontario, BPW Ontario, urges the Government of Ontario, based on this analysis, to put in place policies designed to ensure female physicians and surgeons be enumerated equitably on a gender basis, ensure that transfer payments for surgical procedures made to healthcare organizations address equity issues within each organization, and further be it resolved that the Business and Professional Women of Ontario, BPW Ontario, urges the Government of Ontario to ensure female physicians and surgeons be enumerated equitably. It's renumerated.
Equitably.
Yeah, but it's not enumerated, it's renumerated. There's an R missing. Equitably on a gender basis. So there's a number of things, first of all, that we need to suggest. Over here in this one, there's a double BPW Ontario. So we have to tell them
Yeah,
that.
that's the only thing I think.
That's definitely something we have to say. I would say that we would support this. Am I correct?
Yeah.
I sure would.
Okay. And
Again, that's something I was
remove the-
discussing with somebody earlier this week, and I couldn't believe it.
Okay, remove the double this. Okay, so that's the first thing. Okay. And then go back to my page. The second thing I noticed right off the bat, there was something else. It was this is wrong. It's remunerated. There's an R missing. Okay, so how do I copy this? Where's the copy right
Yeah, I
there?
think you're right.
Remunerated or remunerated?
It's okay. Yeah, the word is wrong. So let's do that. Okay, so
Remunerated.
this has to be, yeah, equals, it's, how do you spell it?
R-E-M.
Remunerated.
Remunerated.
Yeah, remunerated. Yeah, it's,
Enumerated needs to count.
yeah, and that's right. This is wrong. This is the correct word, correct?
I think
I
so.
think so.
Yeah, yeah. I'm 99.9% certain here. It's remuneration is the noun.
That's right.
So these are the first two things that I saw. Okay, so let's just put a dash there and go back to our document. Oops, document, where are you? Right there. Okay, so is there anything else?
It's got it twice in there.
That's why I said to remove the one.
No, it's, you've got further be it resolved, then and further be it resolved, and it had the double BPW Ontario. And put in place policies designed to ensure physicians and surgeons be enumerated or
Yeah, it's got
remunerated
it
equitably
twice.
on gender basis.
Ah,
And
twice.
then, and further be it resolved on the second one.
Yeah,
Yeah, it's remunerated.
yeah,
Right.
it's the wrong word. So let's make it clear that, so this is in two places, in 2 places. Is that clear enough to say it that way?
Well, can you not just write it over it or?
No, you
I don't
can't.
know
No,
how
you can't.
Oh,
It's a
okay.
PDF, so no, I can't.
Oh,
This
okay.
is this is where we're making our amendments and
I'm sorry, yeah,
recommendations.
you're right.
Yeah. So definitely it appears twice. So thank you for noticing. I didn't even notice that it was twice. So there's a double BPW Ontario, but I didn't notice the two enumerated. Yeah, that's the
No,
wrong
I
word.
didn't either. I just
I
saw.
think that that's probably a duplication
Oops, sorry.
that last and further be it resolved probably is not even needed there. But that could be questioned. Just is the last and further be it resolved necessary?
Oh, right. Look at this. Surgeons and equitably on a gender basis.
Yeah, this
And
is the
here
same
you've
thing.
got equitably on a gender basis.
Yeah,
No, yeah, but.
Yeah. They're saying the same thing.
yeah.
So that one
just
could
question.
be,
So you just
Yeah.
question that if
Yeah,
that
no, but they put a
thing.
different sentence, put policies in place. That's different than urging the government.
Oh, you're right. Put in place policies designed to ensure,
Yeah,
and then
Okay.
that to ensure that they're, okay, thank you, Anne, I missed that.
me too.
or
Okay,
Yeah.
so that it is necessary there.
Yeah.
that's why we're all here.
Good catch, good catch.
Yeah, perfect. Is there anything else?
No,
Okay, that looks good to me.
so yeah, so remove the double BPW.
So
and
I've got remove the
enumerate it
double,
in
and
two
then
places.
I'd like to make this, no, not this one. I want the good word to be bold.
Highlighted, Control B.
Control B. Oh, I keep forgetting that. There you go. No,
No, just highlight it.
yeah, and then Control B. There. Thank you. All
Magic.
right. Yeah. Okay. So now we're into a commendation. So we're done with the resolutions, and we're just reviewing the commendation. So it's just a matter of looking at it, because I don't think any one of us will object to that one. Now, the screen, I'd like you to know that at the top, I keep getting a notice that says my screen sharing is paused. So I think you can still see it, can you not?
Yeah,
I'm
We
sharing?
we can just see the form you're filling in, the feedback form.
I can
Okay,
see.
so you're not seeing when I'm sharing you're
No.
coming, really? So how do I do that now? Because when I'm switching back to, what I'm reading, you're not seeing
So
that.
are you on the full screen share?
Yes, I was,
I
but
don't
it
know,
says,
then you
it
may-
has stopped. So let's
Okay.
do it again. I'm sorry, I just noticed it says it had stopped. So now I'm gonna
I've
do
got
it
it all.
there. Now you can see it?
Yeah, I could see
Yeah.
it.
Okay, good. This is a commendation. Now, normally a commendation is not something that we would object to. And I think we've pretty well all read this one. It's quite long. And what all that they're asking is they are commending this organization for its housing projects and programs that assist those with the greatest housing needs in Ontario to find safe and affordable housing, and encourages the organization to continue their high quality work going forward. It's a commendation.
I
So
think it sounds good.
I think it's just the way it is. So we go back to, can you see now that I've switched back to the document?
Unless,
No.
well, for my,
Oh,
I
you're
never lost the document. so.
Right,
back
but
to you're back to the amendment.
that good. So you see it. Okay. Because we are supporting that. So I just have to put yes. Correct? And we don't have any comments to it. Is that also correct?
Yeah.
I don't think we do. And
No,
anybody?
I think it's just good.
It's perfect the way it is. Now we're into this. We submitted this. We worked very hard on the wording. We had a lot of help with it. And what it was that presently we have student members in BPW that are enrolled in 60% of full-time studies. They get a break on the fees. Okay. So presently, we wanted the young BPW, which are members 35 years and under, we wanted them to also get a break money-wise, because a lot of young people under the age of 35 can't afford our fees, so they don't become members. So it's not just students. The students are getting a break, but the young people under the age of 35 are not. Okay, so the yellow is just to show what's already there. And now the pink is what we are adding to the bylaw. And the bylaw now would state that the fee for young BPW members aged 35 years or younger would be 1/2 the fee for members. And the rationale is showing all members that student members have a reduced fee, no request to change that part. This was the yellow. We understand changes to the regulations are the responsibility of the board, but felt that the discussion should include all members. So that's why it's in here.
Okay.
So then again, the yellow is to show what already exists. Young women often experience living costs that are traditionally higher in this age bracket, and we believe this fee change is a way to support and encourage BPW membership for young women. BPW Niagara Falls believes it is important to make the cost of membership affordable for all members to promote recruitment and retention. So this is it. We're not objecting because we've already done a lot of meetings to put this together, and it became part of the proposals for the change. So we're going back to my document. Of course, we are supporting this because we helped to put it together, and we don't really need to suggest any amendments or anything because we did this. This
Can I
was our
make a
work. Absolutely.
I've mentioned this before, Jocelyn, that I feel that we have senior members and many of them are on just their benefits, their pensions and stuff. And I feel that they should also have a break in the membership price.
And do you
Because-
think that by doing it now, by including it in that it would all be voted as one? Or could we wait till next year and then do it separately so that it would have more impact?
I don't know. I just, I mean, I totally agree that the students should have a better price that's easier for them to manage. But we have so many senior
Yeah.
women in our whole
Okay,
organization that I know many of them are struggling on, not everybody's a businesswoman or a working business person anymore. And a lot of them just have their pensions, and it's a struggle for many of them.
it is, I know. My question is, do you want this included in this bylaw now? Or do you want to wait till next year so that it would have more weight?
I'm just seeing how we're losing members,
I know, I know. I
and
agree.
No, but she's not asking you that. She's in favor of what you're saying. She
Yes,
wants to know, do you want to be included with the young BPW, or do you want to wait a year and have it separately? Do you think it would have more impact that way?
well, if that's what we have to do, then yeah, okay, then that's fine. But I think we need to do something about it.
So for example, right now, everything that
But
is yellow is pertaining to what's already there, and it's the members, 35 and younger, and it's the students. Okay,
Yeah.
the members 35 or younger, they're not getting any break right now. None of them. It's only the students that are getting a break. Now, you've got to keep in mind, a person could be 65 years old and decide to go back to school at 60% and become a full-time student, and that person could be getting a break in membership. Actually, the person who helped us do this, Heather, she didn't even realize that she could have asked for a break because she did go back to school full-time. I mean, 60%. She had a 60% course load in which she went back to school. And she could have definitely asked for a financial break, but she didn't need it. So she didn't, not only didn't she know about it because she forgot about it, but she didn't ask for it. So again, it depends on the person's needs.
Yeah.
it does,
No.
it does.
And
Not
it's
all
the
of us
same with
need-
some seniors can afford it and some seniors can't.
That's
In the
right.
same way. Some 35-year-olds and under can afford it and some can't. Same thing.
Yeah.
So if we were to include, my opinion is if we were to include that second one about the seniors, which I'm in total agreement with, but if we include it in this one, it might water down this part,
Yeah.
which is the
Okay.
part that we're going for this year.
Okay, I get that, and yeah, I have to agree with that.
Okay, so next year, I would very much like to continue along that road and ask for the amendment again and have it for seniors. I'm in
Yeah.
total agreement for that. Okay,
Okay.
so do
Mhm.
we need any wording, any additional wording? I did not prepare you know how I've got 3 minutes to talk about it and my supporter has 2 minutes to talk about it, all that stuff. I didn't do any of that. This is the only thing I've done is what's written here. And I think it's enough. Do you think it's enough?
I think so.
Yeah.
Okay. Okay, so if we go here, we just have a simple yes, and
Yeah.
then we're done. So now I'm just going to make sure I save this. I've already got that BPW Niagara Falls up here in the title, so I'm saving it right now. And I can stop sharing this particular thing. And thank you. It is now 9:21. I know that this kind of meeting takes a lot longer than a regular meeting. Normally, we would be done by 9:15 and we'd be start talking about, social things. But this is usually, this type of resolutions meeting takes a lot longer, especially when there are 8 separate resolutions to discuss. So thank
Yeah.
you for your patience with that. I didn't want to rush anyone. Okay, so now that we're done with this, I can actually stop the recording because the recording was just for the resolutions.